Good afternoon, colleagues. My name is Korotkov Climentii. I am a student of the dental faculty of the Ural Medical University. Today I present to your attention a report on the topic Recommendations for an adapted program of dental education and oral hygiene for people with motor pathologies. Scientific supervisors Oshenko Evgeny Sergeyevich and Plotnikov Alexander Sergeyevich. Disability, despite the active development of medicine, is still an actual problem all over the world. In the first and 9 articles of the Federal Law on Social Protection of Disabled Person in the Russian Federation, November 181, clearly defines the concepts of disabled person and rehabilitation of a disabled person. You can see them on the slide. There are more than 10 million adults with disabilities registered in Russia and more than 700,000 of disabled children. The state takes care of children, so the decade of childhood was announced in Russia 5 years ago. The condition of the oral cavity is a basis of health, but dental care in the Russian Federation for people with disabilities is limited. Unfortunately, not all medical organizations are adapted for the disabled person, which causes subjective difficulties. The slide shows an order that regulates these requirements. Insufficient adaptation of clinical recommendations for the disabled people and popularization of scientific publication on the topic worsens this process. New research is needed in this area. The problem of cerebral palsy and motor pathologies is very important because it has a high share in the structure of childhood disability, the severity of pathology, and a tendency to increase prevalence. Naturally, such children have difficulties in maintaining oral hygiene. You can see the problem, purpose, tasks, and hypotheses of the research on the screen. The research was conducted based on 2 public organizations of the city of Nizhny Tagil. You can see the structure and number of participants on the screen. Adapted recommendations on oral hygiene for the disabled people with motor pathologies were selected empirically as a result of the research. You can see the photos taken during the research on the screen. When drawing up the program, it is necessary to take into account the age of the patient, his mental and physical ability. Features of patient with motor pathologies. Among them, there is a prevalence of adenoid type of face, dental anomalies, malocclusion. Pathologies of the dental system are explained by the neuropsychiatric status of the patient, so a person begins to breathe through his mouth. Dental anomalies are aggravated by the presence of neuromotor articulation disorders. In addition, in patients with cerebral palsy, studies revealed a significant increase in uris activity and a decrease in the content of lysozyme in the oral fluid, which is a decrease in local immunity. Separately, we will focus on oral breathing informs the main clinical picture of people with cerebral palsy. Oral typing of breathing, pathologies of functional harmony, morphological disproportion within the oral and parotid muscles, non-expansion of the upper dentition with the age of the child, gothic palate, reduction of the nasal cavity, non-closing of the lips, infantile swallowing, protrusion of the incisor, sagittal slit, sagittal disproportion of the jaws, changing the position of the head, empire posture, chest contraction, and impaired respiratory function. The above-mentioned features of people with motor and visual impairments confirm the need to develop recommendations for individual hygiene, dental education, and rehabilitation of such patients. When working with people with cerebral palsy, information should be short and informative, and speech patterns and examples should be based on their life situations. As a rule, such patients may have limited mental activity, so the material should not be overloaded. Pictures and understandable words are recommended to be used to explain. In addition, it is necessary to actively interact with accompanying person and parents of disabled children, as well as experts in related fields. When teaching such patient oral hygiene technique, it is necessary to take into account that disabled people are not able to hold their body and cannot coordinate their movements because their muscle tone is impaired and the sensory organs are inconsistent. The motor activity of such people is impaired. Therefore, when forming manual skills, it is necessary to focus on tactile sensations and repetition of already studied sections. Conclusion. As a result of the research, the necessity of developing recommendations and requirements for an adapted and personalized program of dental education and oral hygiene for disabled people with motor impairments, taking into account their individual health characteristics, was formulated, provided, and actualized. The need of this participation for a complex approach to rehabilitation on it extremely high, and the individualization of program is necessary. However, this approach requires future study, proof of effectiveness, and specification, which can serve as a basis for future research in clinical practice. The discussion of the creation of a regulatory framework in the field of dental care is necessary to improve the rehabilitation of people with disabilities. Thank you for watching.